I first noticed it about 6 or 7 years ago, and it progressively got more noticeable until I really started having sleep problems where I just wasn't sleeping at all and was getting up in the morning just feeling terrible, run down. And so at that point in time I realized I needed to do something about this, and that's when I started checking with various doctors.
Obstructive sleep apnea is a condition in which when patients sleep, the throat collapses and the airflow down to the lungs is limited. And as a result, patients have arousals at night, which means they wake up, and it leads to low oxygen levels in their blood. So people who are diagnosed with obstructive sleep apnea very commonly feel very fatigued in the morning. They require multiple naps throughout the day. They wake up sometimes in the morning and have headaches. They experience choking and gasping at night. They snore typically.
Either I was sleeping on the couch or she was sleeping on the couch because we just couldn't even sleep together because I was either snoring or I was awake and tossing and turning, and it was not a very pleasant situation for a long time.
The most common treatment for obstructive sleep apnea is CPAP, which is a mask that is applied to the patient's face at night, applying positive air pressure to the throat to prevent it from collapsing. While this is a very effective treatment, unfortunately it is not very well tolerated, and as a matter of fact 50 to 60% of all patients are just not able to use it. They're not adherent to the therapy and remain symptomatic, and continue to be exposed to developing secondary comorbidities.
That just did not work with me. I believe the first time was with a full mask, and I just could not tolerate the mask. And to be honest with you, I can't remember if it was CPAP or BiPAP. Believe me, I've had them all. I just couldn't tolerate any of them.
Those patients should consider exploring surgical treatment options. Surgical treatment options usually aim towards expanding the throat tissue either to the side or from front to back to prevent the tissue from collapsing. There are different types of surgeries that may include straightening the nose, straightening the septum, removing the tonsils or the adenoids, removing some of the back of the tongue just to create additional space. Inspire therapy is a newer therapy. And it is a pacemaker-like device that is implanted and is controlled by the patient via remote. The device synchronizes breathing with your throat muscles and provides gentle stimulation to a throat nerve, which keeps your throat open at night. And it's a very well tolerated procedure and is very well accepted by patients who suffer from obstructive sleep apnea.
The Inspire system, I had never heard of it at all, and he explained it to me and said if I met the criteria that he felt that it could do me some good, and so that's kind of how it all got started.
The procedure itself is well tolerated, pain is quite minimal, and the results we have so far with this therapy are excellent.
It's been a game changer for us because we sleep together now, where before, as I mentioned, she would either go to the couch or I would because I was tossing and turning and she couldn't sleep. We look forward to doing things together that we didn't used to do simply because I was always so daggone tired. And like I said, it's just been a game changer. We've been married 47 years. And this has been something that I think has had just a very, very positive effect on our relationship and how we live together.
What is so rewarding about my job is that in many cases I can offer alternatives or options to improve their symptoms. And when patients have undergone successfully their treatment and they start feeling better, it is one of the most rewarding things for me to hear their stories.
My brother and I run a fishing charter boat on Lake Erie as kind of a part-time endeavor. We live an hour and a half away from where the boat is, so a lot of times we're getting up at 4:30, 5 o'clock to be able to drive to Conneaut to get to the boat and get ready to take our charter out for the day. And now I can get up at 4:30, 5 o'clock and I feel good.